Hello everyone, drberkkkaratas. Our topic is sexually transmitted diseases. Now, this is a very complicated topic, but I'm going to tell you what you need to know very briefly, very quickly. There are so many tests on social media, on the internet, you don't need to know any of them. If you understand the basic logic, I will understand what I will understand a little later, and then we will be treated by a doctor anyway. Now, when we look at sexually transmitted diseases, there are bacteria, viruses, protozoa, fungi, parasites, many bacteria. Do we need to know all of this? Of course, we don't need to know, but there are some special cases. For example, there is a bacterium called Nalsagonary, which makes the waste sting from bacteria. Again, syphilis has effective treponema. Chlamydia is the most common sexually transmitted disease and its spread is quite high, especially in women, as it does not cause symptoms and complaints. In worldwide surveys, 500 million people a year know what is recorded in some way every year. There are also those who are unregistered. Of course, the number increases a lot at that time, but those who are registered, 500 million people get one of these diseases. There are viruses. We have already mentioned genital warts. If you remember, we made a video of it. I'll talk more about AIDS later. There is jaundice, genital herpes. In women, the cause of vaginal infection is Trichomonas vaginalis. There are fungi in the groin is over. There are also ailments such as scabies. These are factors. Now we're going to ask 5 questions here. We're going to answer those 5 questions, and we're going to get this done. First, the first question we ask to get a sexually transmitted disease is: has there been a suspicious sexual intercourse? If there has been no suspicious sexual intercourse, these diseases do not pass through this air, water, furniture, soil, shaking hands. There must necessarily be sexual contact. Kissing, penis-vagina intercourse, friction must be these. These are transmitted by oral intercourse, anal intercourse, vaginal intercourse. It ranges from 2 days to 6 months on average. There are some diseases, for example, gonorrhea can complain in 2 days. However, it takes 6 months for the symptoms of AIDS to appear. For him, this time is important. Now there is also one more question. When you say suspicious sexual intercourse, what does it mean? This means that anyone who has been together for 3 months or more, that is, with whom you have not been together regularly, is a suspicious sexual relationship for you. I sometimes ask patients, have I had a suspicious relationship? No. Why? I know him. Just because you know a person is your spouse, a friend at work, doesn't mean he's not suspicious. Therefore, if you do not have a regular sex life with that person, then every person you are with is a suspect sexual relationship. Okay, so we've answered our first question: is there any suspicious sexual intercourse? You said there is. Then comes the second question: what complaint do you have? Do you have a discharge? Do you have a wound? Do you have complaints such as general fever, nausea, weakness, eye infection, joint pain, low back pain in the penis area, vaginal area? These are being asked. Now the discharge is already very pronounced. It is also very evident in women, especially in men. In men, in this way, a yellow-green mucus-like discharge may come from the tip of the penis. Or in this way, lighter discharge may come. Both are infections in general. When we see this, if we already have a suspicious relationship, we make the diagnosis. In other words, we can say that you have contracted the disease. Or there will be wounds and lesions. For example, here we have already mentioned, there are genital warts. This is what genital warts look like. This is, for example, the herpes virus. There is also a herpes on the lips and the penis and vaginal area. This is the penis out. And this is syphilis. Of course, syphilis is not a common disease at the moment. In other words, it was said in the past, for example, that the kings of England died of syphilis. We don't have a sultan in our past who died of syphilis. It may be asked if there are general complaints. Or there isn't. Look, if you have a suspicious sexual activity here and you do not have any complaints, this does not mean that you do not get a disease. Because many of those who get these diseases do not have any complaints, especially in women. In other words, there is no general complaint, no discharge, no wound, and none of these. In other words, there is no general complaint, no discharge, no wound, and none of these. Then we become carriers. The disease can occur at any time. This word none is actually quite important. It is very important in terms of its spread. Well, we have suspicious sexual intercourse, we have such a discharge or a wound. What are we going to do? How are we going to diagnose? If there is already a current here, our job is easy. From here, culture can be taken, looked at with a microscope, and we can easily diagnose the bacteria I just mentioned. If there is a lesion here, we can take samples from these lesions. We don't need to take a sample for warts. This image is already enough for us. Blood tests may be done. For example, tests can be done for AIDS, for health. There is also a multiplex PCR test. This has become very fashionable lately. In fact, it has been around since time immemorial. I'm going to make a video about it. These multiplex PCR tests are very valuable tests. Instead of looking at diseases one by one, we can say all of them at the same time by looking at their DNA, that is, by looking at their content. These can be done. In other words, if there is an image like this, it is not very difficult for us to diagnose it. The problem is in those who do not have such an image. How is the treatment? For example, if you have a discharge like this, you are done with a single dose of antibiotics, that is, what you swallow from the pharmacy. The disease ends. It can be treated as simply as that. If there are warts as you can see here, wart cohesion can be done. What does it mean to say that there is no cure? For example, there is no cure for AIDS today. There is no cure for warts, we only burn the lesions, you know, I mentioned it before. But in AIDS and jaundice, we prevent the progression of more diseases. Is partner treatment necessary? Yes, it is a must. My advice here is that you got a job with a suspicious breed and got the disease. Be sure to tell your partner, the person you are with, that I have such a disease. The other person can say, no, I don't have any discharge, no wounds, no bruises. I just mentioned that he can be a carrier. Tell him that and you can be a carrier. Therefore, you can definitely see a doctor. Women can go to obstetrics, men can come to the student specialist. Now there is a very important question here. After describing this video, this question will be asked. Sir, I have entered the suspicion into sex, I have no complaints, what should I do? Should I do nothing? I don't think we should do anything. Even if you do not have any complaints at least 2 weeks after intercourse, these multiplex PCR tests can be studied and checked to see if there are any bacteria I just mentioned. AIDS and health viruses are not immediately looked at. We first look at it after 3 months, that is, 3 months after the relationship. Is it enough? It's not enough. We also need to look at the 6th month. Because the body's reaction to these viruses continues to increase after 3 or even 6 months. That's why I say that it is necessary to look at it in the 3rd and 6th months. So what should we do here to protect ourselves from these diseases? Okay, we may or may not enter the suspicious workshop, so the best thing for us is monogamy. I always say it's not okay to be with one person while you're with another, especially for married men or men who are partners. That's what we call single accompaniment. Single accompaniment is the most effective method for the prevention of this disease. Of course, it is very effective to use condoms and condoms during intercourse, but condoms should be used at every stage of this relationship, that is, in penile-vagina intercourse and oral sex. We see a lot of vaginal, here I had intercourse, I used condoms, but it still happened. Where did it come from? Oral sex, of course, because these diseases can live in the mouth and these substances can live in the mouth. Also, it is very important not to use vibrators, needles, injectors at work, or it can be used after sterilizing them very well. There is already vaccination against hepatitis B in Turkey. We also recommend that girls and boys aged 13 to 14 years be vaccinated against genital warts. We also made a video about genital warts. There, in particular, was the vaccination department. Please watch it as well. Especially if you have children or are at this age, I recommend that you get a genital wart vaccine. Should we try for a multi-PCR test even if there are no complaints after sexual intercourse? I think let's work. This both relieves us, and if we are not sick, if we are going to carry it, we will not infect someone else next time by taking the treatment of it. It doesn't matter if it's a man or a woman. Also, if you suspect an infection or if you suspect something during intercourse, please do not waste any time as soon as possible. Here women can go away to women's diseases and men can go away. You can go to your family doctor, you can go to your health centers. The doctor friends there can also apply these treatments very well. Of course, the latest situation is to receive sex education and counseling. Of course, this is my dream. I don't know how possible it is to do such a thing in Turkey, but I wish sex education and these lessons were given in high schools, and we would start life much better if these subjects were taught. In other words, it can be like starting life with a zero. It is very important for us to get consultancy and consult. Therefore, these are the issues that you need to know about sexually transmitted diseases. In my opinion, don't get too hung up. If you have a suspicious relationship, please go to the doctor, whether you have a complaint or not. If you have a complaint, be sure to go to the doctor. The rest is up to the doctor. Basically, you just need to know them. Thank you.